Good morning, everyone. It's Tuesday, November 2nd. Welcome into the Morning Medical Update. We are live inside the Dolph Simons Family broadcast studio. Today, we are talking about the short amount of time, the very short amount of time between now and when kids 5 to 11 will be authorized to get their vaccine. In just hours, a CDC advisory panel is likely to give the green light, allowing children between the ages of 5 and 11 to receive the COVID-19 vaccine. We will outline what we are doing to make sure parents know when and where they need to go to get it for their kids. And we know you've got a lot of questions, so start getting those in. You can send those in via YouTube, Facebook, Twitter, and also you can email those to the Medical News Network. You can find those links right there on your screen. But first, Medical Director of Infection and Prevention and Control, Dr. Dana Hawkinson joins us with our numbers. Any changes from overnight? Good morning.
Yeah, we do have a large decrease in active infections. We have 12 active infections today. I believe yesterday we had 18 still. 6 of those patients in the ICU and 2 on the ventilator. We still have 24 in that recovery period, so a total of 36. And Hays has actually 11 active infections and 8 in that recovery period as well. So, the numbers have gone down. That's great. We've seen over the course of the past 2 to 3 weeks the case numbers decrease. But again, it is just one day, so we'll kind of see what this trend continues to be like.
I think it's really important. I mean, 12 was one of the lowest numbers we've been at for a long time. The one thing we have to have a caution about is winter, going inside, and mask mandates are going to be coming up for renewal here in early November. I think there's likelihood they're going to go away. We just have to be thoughtful about that. An example of what can happen, if you look out in Europe right now, there is a significant rise in Europe. Another wave that's starting in the more Eastern-oriented nations in Europe because they have perhaps a little less vaccination, more vaccine hesitancy. They're seeing a big rise in cases, whereas Western Europe is not because they have higher vaccination rates. You translate that to the United States because Europe is often presaged what's going to happen here, then you just say, okay, if you're unvaccinated, be careful. And I think as masks come off, we're just going to have to be careful because we could see another increase, and that would be painful.
Dr. Stites is with us today.
Yeah.
And Dr. Angela Myers from Children's Mercy. Just want to make sure all of our reporters on the line know that. How are you today, by the way?
Fine, thank you.
Good. Thanks for being with us here in studio. Good to see you.
Good to see you too. Thanks for having me.
Dr. Stites, how are you doing? You stayed up late watching Chiefs, or what did you do?
I did. I was hoping for a little better, cleaner game. I want to make it clear that COVID shots do not make you play like that. We won, a little tight, but just remember the Los Angeles Rams and I hate to say it, but the Raiders and other teams like that, they've been vaccinated too. So don't blame the vaccine on the seeming funk that the Chiefs are in.
Okay, I came from Las Vegas, and so I get that question all the time. So are you a Raiders fan? And I have to kind of keep that on the down low sometimes.
Wait a minute, are you a Raiders fan?
No, I am not. For the record.
Are you a Chiefs fan?
Yes, I am.
Okay, because if you're a Raiders fan, we're having to realign the studio.
I can't even say the word, the R word.
No, you do have red on, so I'm gonna go with the Chiefs.
Okay, well, I know, but if I go for the Raiders, not too bad right now. So,
yeah.
Okay, let's see if there's any reporters on the line today with us.
They'll do a Raiders thing soon enough.
Mm-hmm.
Good morning, Charlie Keegan here from KSHB 41.
Hey, Charlie, good morning.
Hey, a question for both contingencies here from KU and Children's Mercy. Do you guys have Pfizer vaccines for children on hand? I know the company's been distributing them. Have they arrived in Kansas City?
Do we?
I believe we do. Do y'all have some?
I don't know if we actually have received vaccine yet, but we have ordered it and should be coming from the state. So if we don't have it today, we should have it tomorrow.
Yeah, I was going to say, I will give the same answer. I actually thought we did have vaccine.
Yeah.
I thought we had talked about that last week. But you know what? In the context of this conversation, we'll check and find out.
That was the big thing from the Biden administration was they were rolling everything out to be ready.
Early.
And they have to send out because they come in a different dose vial, right?
Well, it's a slightly different formulation when y'all want to take that on.
Oh, yeah. So it is in a different vial. It has an orange top instead of a purple, which was the adult dose. It has a different number of doses within the vial, 10 versus kind of 5 to 7 is what we saw early on. And it has a different diluent there's a different amount that goes in the syringe. So it's a little bit smaller dose.
And isn't there a slightly different makeup of it too? Isn't there one? I thought there was one thing. We talked about this last week, and I actually was educated about that. I thought it was slightly. Am I wrong? Not only is it a smaller dose, but I thought there was something different about it.
The diluent is a little bit different.
Okay, that's it. Yeah.
What is that?
What they use to mix it with, the diluent.
Okay. I don't know these words. I have to
Yeah,
ask
it's a big
these
word.
questions.
Well, see, any drug has to be mixed in something.
Okay.
It has to keep it. You have to keep it active, protected, safe, preserved, and that's the diluent that is put in. There's more to that story than that. But let's just say that that's it. And so, as it's diluted in something, what's it diluted in? It was diluted in something slightly different, altogether safe. That's one of the reasons they had to do extensive testing on it with all the kids to make sure that they responded to the diluent. But I think it had to be just a little different because you're giving it to younger people.
All right, other questions?
I'll throw one more out there for you guys. What kind of role, I guess, does weight play in a dosage for a child when it comes to vaccine? With like Tylenol and whatnot, we look at a child's weight. How does it or does it not correlate to vaccines?
It's a great question.
Yeah, it is a great question. So, back in the spring, the drug companies did studies looking at what was the right dose for the age group in kids. They did what's called a dose finding study, where they looked at different doses to see what produced an immune response but had a low amount of side effects, or those reactogenicity that we see with vaccines. And so they settled on the dose of 10 micrograms, which is 1/3 of the adult dose. That was the dose that produced a robust immune response but had a low rate of side effects.
But I would say also, we typically don't use vaccines for weight-based dosing. Isn't that correct, Dr.
It's
Myers?
age-based dosing for children primarily, not weight-based dosing. And so that's why it's going to be important to really stick to what the guidelines are from the CDC after they meet today. So the dose for 5 to 11-year-olds is different than it is for 12 and above. And it's important that parents remember and doctors remember to make sure kids get the right dose based on their age.
And I know a question we had gotten last week was, well, what if I have a child that is 10 or 11 and quite a bit overweight or maybe underweight? But again, the example you gave, Tylenol, things like antibiotics, we do that by weight-based dosing. But remember, for vaccination, really the meat of what is happening is occurring in those lymph nodes and in that shoulder where it was injected, but also in the lymph nodes there around the armpit, the axillary area. And that is really where all of the action takes place. So that little bit of antigen that is created is creating that immune response. It's a little bit different than when you're talking about Tylenol or antibiotics, where you need what we call a volume of distribution. You have to take that into consideration. Also, what tissues are those drugs going into? This is not what occurs with vaccination.
I think we're good. No other reporters on the line. All right, Dr. Stites, you have to scoot around, what, 8:40?
I do. Clinic. Got to go see some patients today. Looking forward to that.
Got to go be a doctor today.
Yeah.
Gotcha. And
Shocker.
so
They'll
get
still
your
let
questions
me.
in. What's that?
I said if they'll still let me.
They'll still let you. Okay. All right. So we're going to get to your community questions here in just a minute. So get those in if you have some for Dr. Stites. But first, our topic today. The news that some 28 million children could get the COVID vaccine is welcoming news for many doctors, pediatricians, and of course parents. I know I'm one of them. Last week, the FDA said that about 70% of 5 to 11-year-old hospitalized with COVID had other serious medical conditions, including asthma and obesity. More than 2/3 of children hospitalized are Black or Hispanic, which is mirroring long-standing disparities in the disease's impact. So we want to turn to our guest today, again, alongside Dr. Stites and me today, is Dr. Angela Myers. She's the Infectious Disease Director at Children's Mercy Hospital. We're so glad you're with us today.
Thank you.
Good to see you. So I just want to jump in, first of all, because you've got some numbers. I think sometimes it's easier for people, normal people, not doctor people like me, to understand when you get to see the big picture of how many people and how many kids it's affecting. So could you just run some numbers for us?
Sure. A lot of people have this perception that kids have been largely unaffected or are not as affected as adults. And there have been almost 2 million children in the 5 to 11-year age range that have been infected with COVID-19. And of those 2 million, about 8,300 were hospitalized. And of those 8,300 hospitalized, 1/3 of them ended up in a pediatric ICU. So children are affected. We've had 94 deaths in children in that 5 to 11-year-old age range. And we've also had a lot of children who have suffered from MIS-C, the multisystem inflammatory syndrome of children. And that is actually the peak age range when we see it in that kind of 5 to 11 or 6 to 12-year age range. So the ability to give vaccine to these kids is going to prevent a lot of disease, but also prevent a lot of inflammatory syndrome post-disease as well.
All right, also joining us from his clinic in Prairie Village is Pediatrician Dr. Stephen Lauer. Good morning to you. How are you?
Good morning. Doing well. Thank you.
All right, so I'm going to ask you a couple questions. I want to know what you're seeing and what you're hearing from parents when they come into your office. I know there's a lot of anticipation for this shot. What questions do parents have at this point?
Well, a lot of parents are just asking, when can we get it? They're very anxious, as are some of their kids, about getting ahead of this and getting vaccinated against COVID. Other parents are more wary about it, still have a lot of questions and want to know what we think, what's going on, and what we think the risks are. And so always glad to have those conversations with families. There's still some families who just are have listened to a lot of misinformation and still somewhat opposed to the idea, but we're willing to talk with everybody, really want to get the right information in front of families so they can make the best decisions for their children.
Are you finding that there are parents who are willing to get vaccinated but then are now still concerned about getting their kids vaccinated?
Yes, that's going on. Parents' job is to protect their children, and there's again a lot of talk out there about what the vaccine does or doesn't do, and the possible harmful effects versus the protection it provides. So, just a lot of good questions from most parents about what this means. Should they or should they not go ahead with the vaccine? And again, always glad to have those conversations with them and get the facts in front of them.
Dr. Myers, what are you seeing? What are you hearing from parents?
There are some parents who are concerned or have questions around the myocarditis that has been seen in teenagers and young adults. Want to see that. We know that there weren't any myocarditis cases in the studies in 5 to 11-year-olds. Now, again, that's a smaller portion of people, and so we will see, hopefully we'll get to see the data today when the ACIP meets, but then also as it rolls out. But what we know is that the risk of myocarditis from vaccine is far, far lower than the risk of myocarditis from infection itself, and much more mild as well. So that's one thing parents are concerned about. Parents have heard myths around infertility, and there's numerous studies out now that women who get vaccinated do not have any more difficulty getting pregnant than those who are not vaccinated. They carry their babies to term. They have no bad outcome. So there's just really no risk related to that, despite the fact that kind of myth keeps circulating.
It's interesting because we've had both Carrie Weinecke, chair of OBGYN here, on the program talking about exactly that women do just fine with pregnancy. And Kevin Ault, who's one of our OB infectious disease doctors and on the CDC advisory committee, so we'll get a download from him today, saying the exact same thing. I don't think that should be a concern. And when I was looking into the myocarditis question, it occurs about 1 to 2 times in 10,000 cases of viral illnesses, or just in the general population, which appears to be about the same data in the Pfizer population in the study. So if that's the case, that's really not an elevated risk of myocarditis in 5 to 11-year-olds. So to your point, we'll see more of the information today, but that's the numbers I think that are out there right now, in which case it's really not above the general population, and it shouldn't be really considered a risk in this age group, maybe in an older age group, but not in the 5 to 11. I bet that's what it's going to show.
I think it probably will too, and I'm anxious to see that.
So I have a reporter question from John. He wants to know, how quickly will hospitals and doctors in the metro area be ready to administer the vaccine to the 5 to 11 age group should the CDC recommend its use later on today? Dr. Lauer, what does that rollout look like inside, pediatrician's office?
Well, the first thing they said, we have to actually get the vaccine, and that should be happening hopefully within a day or so as they roll that out. It's also, there's a lot involved in getting the process set up, getting the clinics open, getting space for this, getting the orders and the electronic medical records all set. So that's our pharmacy and nursing teams are working on that very diligently. But the hope is that by sometime next week we'd be in a position to do this, but we want to do it the right way too. So as we get those dates clear, we'll get that information out to everybody. But certainly the goal is to get this done as quickly as possible and as safely as possible once we actually have the vaccine on hand.
It's funny, just to say that one of the things we have to work on, the thing with Epic, with the electronic system, you do have to, Epic has to release certain order sets to us that we can use those and get those implemented. And to also follow up on, and correct myself from earlier, we have checked. We don't have the vaccine yet. Like you, it's been ordered from the state. So hopefully it should be arriving as soon as they release it, because I do believe it's been distributed to the states and then should come to us. When do you guys think you're going to be ready to start giving vaccination?
So I think we'll probably get vaccine tomorrow, and then my hope is that we're ready to start with our first big vaccine clinic over the weekend.
Yeah.
All right, so I have a couple other questions that I want to ask. We're going to take some community questions because I have some questions that I want them to come from you all. So let's get to those. Lori wants to know, my daughter is 11, turning 12 at the end of December. This question we get a lot. Should we wait until her birthday in December to get her full dose, or will that smaller dose just keep her just as safe for that long? She is a taller, bigger 11-year-old than some of her friends.
Yeah, and a lot of parents have that, or my 5-year-old's really big. They're more like an 8-year-old. Really, if you have it available to you and you can get it, then I would just get it and get the 11-year dose. If you don't and it's not going to come and your daughter turns 12 in the meantime, then that's fine as well. We really don't dose vaccines based on size or weight. They're based on age. There's a lot of changes that happen in our bodies around that age, hormonal and growth and all kinds of things. And so they're just dosed a little bit differently than other drugs that we use.
Dr. Seitz, I think you had mentioned this because I've asked you this question before, and you were like, well, you could wait, but when you wait, does that wait turn into 2 weeks, 3 weeks, a month, 3 months?
Right, or does it turn it into a disaster? And because then your child gets COVID in the meantime, and then gets really sick, gets MASC, and you're going to say, man, I should never have waited. I think the important point is that the 11-year-olds in the Pfizer study do very well once they've been vaccinated, and still has a really high effectiveness. And so I don't think I would be worried about that. I think I would just give, to be honest, we never knew exactly what the right precise dose was, and we might be able to get away with a smaller dose. So I think I would be very optimistic. I would say if it's available to you, go get the dose as soon as it's available.
Well, and also don't forget the trial was done on these age groups.
Yeah, exactly. And Hawkeye, they did well in the trial.
Yeah, I think immunologically, again, 11 years and 11 months is no different than 12 years and 1 or 2 months, really.
Right. And so you're still going to respond. You're still going to get I think that's important.
And I think with that lower dose, and what they chose the lower dose is one of the reasons is because of reduction in some of those side effects. And I think the important thing here is that you are giving your child an early antigen prior to this infection so that you can mount that immune response to help reduce the rates of what we've heard Dr. Myers talk about. Reduce the chance of getting long COVID, try and reduce that chance of getting the multi-system inflammatory disorder. Giving your child that early presentation of that antigen through the vaccination, which we know is safe, so that they can mount that immune response much quicker.
And to your question, though, I think that if you start saying that, well, I'm going to wait 4 weeks. Okay, well, you're going to wait 6 weeks, you're going to wait 8 weeks, you're going to wait a month, 3 months, you're going to wait 6 months. How long are you going to wait? And my advice is, waiting's just great until your kid gets sick. And then you're like, man, I shouldn't have waited. That was a really bad choice. And, I was sitting here listening to your numbers this morning. And, if you've had almost 100 deaths from COVID-19, right?
In just that age group.
Right. And
we've had far more than 100 deaths.
Right. But just think about it. That makes it really very real, right? Because I think you're right. Parents are like, kids don't really get that sick. Well, yeah, they don't get sick, but they do get sick. And that has got to be probably one of the leading causes of death at children's right now.
So overall, it represents 1.7% of pediatric deaths in that age group, across the country, but it's in the top 10.
Yeah, and it's unnecessary, right?
It's unnecessary.
And I think another point is, again, we are now going to be doing things more inside, gatherings, whether for holiday reasons or to watch football, basketball, all that will be going on inside. We know the holidays are coming up. It is about the individual, that child, but it is also about other people around that child, so it's not the individual. And that's a lot of things that people seem to forget. Well, I don't need the vaccine because I'm going to be fine. I'm young. I'm going to be healthy. I'll take my chances. It's just a mortality rate of 0.05%. So, I think the individual, the child is more than likely going to be well, but it's also about the people in that child's bubble and around, and we know that we are getting into the gathering season. And so to help reduce the chance of, number one, infection, but also reduction of spread of that disease to those other more vulnerable people, I think is an important note. Thing
I like
to note.
that. The gathering season. That's good.
Yeah, we'll say that, the gathering season.
I like it.
Melanie has a question kind of along the same line. Maybe Dr. Lauer, you could get us started. But if I do have an 11-year-old that turns 12 soon after I've given them the first dose, will I go ahead and get them the second dose for a 12-year-old? So you'll get a half dose when you're 11, and then you would, for your second shot, you would get a full dose. Is that correct? You'll be giving 2 different doses based on their age.
My understanding is that you would complete the dosing regimen you started on, just like everybody else has so far. So again, the efficacy in terms of creating an immune response in the trials was very good at the dose they settled on. They just settled there because of the reduction in side effects. It was not a reduction in the immune response. So right now the goal is to get the vaccine into kids, get them that protection that they need for themselves and for everybody else around them, which is an incredibly important point in this, and go ahead and just follow the rules the way they're coming out right now. All those are going to, we expect, change and evolve as we go through this over the next months and probably years. But for right now, it'll be going with the guidelines as they come out and keeping the doses the same.
Okay, so if you started on the lower dose, you get the second shot as the lower dose, regardless of age. That's what you understand that to be.
That's what I understand, yes.
Okay, so do we know, Emily wants to know, any idea of if and when our 5 to 11-year-olds will need a booster after fully vaccinated? Dr. Myers, have you heard about a booster for kids? We're just wanting the first shot for kids at this point.
Let's just get going.
Right.
That may happen at some point. That may become necessary, but I don't think we have any reason to believe right now we need to worry about that. We just need to get all the kids vaccinated. And my hope is that by getting 5 to 11-year-olds authorized to get the vaccine, we can even push a little bit further in the 12 to, through 16, 17-year-olds where we're still kind of lagging. We've got some work to do there.
I love that. Let's just get started. That's pretty good.
Right?
That was good. There's only a little bit of exasperation in your voice. That was good.
So what will this be? Will this be a game changer once it's available for kids that are sick? I mean, kids that have asthma and some of these other major conditions. I mean, how life-changing will this be? And what kind of relief would that bring for a parent, knowing that they're protected at least from this?
I think it will be. What we've seen in the hospital certainly is that there are risk factors, just like there are in adults, that make you more likely to have severe disease. And obesity is the number one. And if we can prevent infections in those kids by getting them vaccinated, prevent hospitalizations, prevent long symptoms, the recovery time can be prolonged. This will be a fantastic game changer for people.
Are there any side effects that parents need to know about? I mean, even in the slightest way?
Well, anytime you get an injection, you may have some redness, some swelling, and some pain at the site of injection. That is true for any vaccine. That's okay. That's expected. It's known, and it goes away in a day or two. The symptoms after the vaccine in kids were pretty unremarkable. Maybe a little bit of low-grade fever, maybe a little bit of muscle ache, which is similar to adults, and actually even a little bit less. So in that sense, no, I wouldn't be super concerned about side effects.
Dr. Hawkinson, Isaac has a couple questions. What are we seeing as far as flu patients? People who sick enough? Are we there yet in the flu season?
We're really not there yet. I did look last week at the CDC data, and there was still very, very low activity of influenza around the nation. Again, that data does lag a week because they need to get it and input it. But also what we've learned from Australia, but again, I think they have a little bit different social things going on there, especially with mandates and restrictions. But they only had like 550 or so verified cases through the whole country during their influenza season, which is really just ending. But right now, overall, very low influenza activity.
It's less than 1.2% of specimens tested, which is where it's been now for the last 6 or 8 months.
Yeah.
It's been really low, and it keeps bumping along low. And you guys have you seen any cases
We
yet?
haven't seen any cases.
Yes. The
We're
longer the
still
better.
seeing RSV, but no flu.
Yeah. As RSV, did it settle down?
You know, it's lower, but we still, I think we had 18 kids in the hospital with RSV yesterday.
That's a lot.
It's still a lot.
Yeah.
And,
okay.
normally at this time of year, we're still not seeing it yet.
So we actually, we definitely could expect. I think that was a great point, Dr. Stites, that you brought up, and we have seen this now resurgence of RSV for a little while, which is delayed from the previous year, but we certainly expect or are prepared for those increase in influenza cases.
All right, Dr. Myers, you brought up RSV. So what is it? What do parents need to be looking for? I'm just curious.
Oh,
and
sure.
what age groups?
So RSV stands for respiratory syncytial virus. Generally, it's the youngest age groups that get infected and then, may need hospitalization. So it's a respiratory illness that causes bronchiolitis with a lot of cough, sometimes wheezing, sometimes an oxygen need, which is what lands you in the hospital. In older kids and adults, it's just a common cold. It's just one of the common cold viruses that we get, over and over throughout our lives.
All right, so I've got young ones. So any symptoms I should be looking out for? And when in the season does this hit some sort of peak?
So normally we see RSV starting in sometime in November, but really peaking in in the wintertime, so January or February, and then tapering out through the spring through March. And the hardest hit are usually that 6 months to 2 year age of kids. And then older kids also get it, but generally don't need hospitalization.
But this year it's been harder. You guys had a peak in the middle of the summer, which is kind of odd. It's kind of like after mask mandates ended. Here came RSV.
It was a huge onslaught. And so July, August, September, we had a ton of RSV in the hospital. We still have RSV in the hospital, although it is on the decline. It's incredibly unusual. We've never had summer RSV before.
Any speculation as to why that happened?
I think it's because the mask mandates went away.
Yeah.
And it wasn't just that, it was a combination of that we didn't have any RSV from March of 2020, right? So over a whole year had gone by before we'd seen any, and a whole birth cohort happened in the United States during that time who had essentially no protection because they had never been exposed to it. So you kind of had this double whammy of people with no immunity and no masks now, and everybody kind of getting together.
Yeah, so interesting because I think it's only really the RSV was the big thing with that because we didn't see an outbreak of influenza. We saw the outbreak of RSV, so that was odd, I thought. And just to say, one of the challenges for RSV patients and for those who have asthma, whether you're really young or middle-aged or with some of my older lung transplant population, we really hate RSV because they don't particularly do well. All the CF patients in the world, RSV, bad news. So yeah, we just soon it go away. So take care of that.
Okay, we'll get on it.
Dr. Hawkinson, Tanya wrote in, wow, when was the last time that we've ever had this low number of active infections?
No, it's probably been back in the summer. We got down, and then, last April we got down to 3. So we're really thrilled to be at 12. That's a great number. Yeah. We got down to some 10 and 11s before, and then it scooted back up. And I will tell you, I was surprised by that number today because we've been in that 18 to 24 range and just kind of hanging there. Right. And we even had a question from one of the reporters, is that our new normal? And we're thinking, this could be our new normal. 12 is a great number. Yeah. Let's see if it lasts. Let's hope it stays low.
And, I agree with you, too. I was actually just having a conversation with one of our colleagues, one of your partners, Dr. Postigo, one of the other pulmonary docs, on the way in, and I said, I think we are expecting to stay at this high teens, low 20s for some time. So again, it could just be a dip. Hopefully it's not, but it could just be a low blip, and we'll just kind of wait and see.
Yeah, I hope it goes back down to 2 or 3. That'd be awesome, although I don't think that's what's going to happen.
Yeah.
And you guys are down to how many?
We have 1.
That's awesome.
In the hospital right now.
Yeah, because we were high. You guys up into the 20s.
Yeah. We did.
That's a lot for kids, so I didn't like that.
What age groups?
Like that
what was that?
It was all age groups. We had babies in the NICU with it all the way up through, early adulthood.
Melissa wants to know, what did the trials show for protection for 5 to 11-year-olds after the first shot while they're waiting for the second shot? Have we heard any info on that?
I don't know what the exact number is, or that hopefully, again, we'll see that today when the ACIP meets. But what I do know is that after that second dose, the protection was 93%. I mean, it was really high. So I feel really good about that. In the adult data, it was around in the mid 50s, I think, between the first shot and the second shot. So it's probably similar for kids.
Isaac wants to know any reason as to why myocarditis is more severe from COVID as opposed to from the vaccine.
Well,
Sure, because the virus is causing the inflammation of the heart and the lining of the heart versus this just transient kind of immune response to the vaccine that then tamps itself back down in a few days. And the virus itself can cause heart damage, which then causes it to be longer lasting, whereas the vaccine really isn't. It's just causing this transient inflammation.
I would remind us that the vaccine is just it's just a piece of material. It's the protein, right? Whereas the virus is going to come in and invade your cell, and that's the difference. And so in this case, virus, and it's not just COVID-19, influenza virus, RSV, they can all invade cells throughout your body. That's why you get symptoms. Like you have sinus symptoms, you have a cough, you have a runny nose. Okay, that's the virus getting into your cellular structure. And the same thing happens in this case. The virus gets into your heart structure, causes the direct inflammation and damage to the heart.
Yeah, I think that's the important point there, Steve, is it's not just this virus. It's really a lot of different viruses, influenza, other respiratory viruses that we see, and they are all more dangerous than getting the vaccine. There are some people, one woman I had a few years ago, unvaccinated, got influenza, and then 7 to 10 days later was in the hospital with heart failure and did end up dying. And so we do see it much more, and throughout my practice with my partners, typically maybe 1 to 2 a year of myocarditis due to a viral illness that is not COVID, that we've been seeing now for years. So.
Hey, Dr. Lauer, Elena has a question. My daughter just turned 5 within the past week. We have been waiting for this day a very long time. Should I have any hesitation for any reason giving it to her right away when it's available?
No. I'd say go ahead and do it. This is the chance we've been waiting for. This is the way we're going to get out of this pandemic, both for your daughter specifically and for society as a whole. We have got to get this new cohort of patients vaccinated to get us towards that level of immunity against the virus that will allow us to get away from masks and quarantines and all the things we've had to live with for the past 18 months. So no, please go ahead. Everything says it's safe to do. Again, the questions about the possible effects of myocarditis, which are very rare and transient with the vaccine, just indicate how carefully this is being studied and gone at before its release. So no, go ahead. We think this is the way to go to help both your daughter, your family, everybody around her. So yes, please go ahead.
And,
Dr. Hawkinson?
Kind of going back to that last question too, looking back on the data from Pfizer that went to the FDA, as far as when do you provide protection, it looks like really at 21 days after that first dose is when you started to really have a separation of those curves, meaning that the people that got vaccinated were not getting sick, but the people that took the placebo were starting to get sick. So that's when you started to see the best efficacy at that point.
Sarah on YouTube has a question. When will we be notified as soon as Children's Mercy will start vaccinating kids 5 to 11? Do we need to schedule that?
Yeah, so we'll be by appointment, and we will be pushing that out through all the social media channels, and we'll have it on the website, and we'll make it real easy for parents to sign up and get their kid an appointment slot and get them vaccinated.
Hey, Dr. Lauer. Oh, go ahead.
I was going to say, Steve, how are you going to do it over in Peds here?
It'll be the same way exactly here. As soon as we get those schedules set, have everything in place structurally to do this, we'll be pushing that information out through every possible channel we have to get that information to parents so they can get their child's vaccination scheduled.
Hey, Dr. Lauer, you and I were talking the other day about how to prep our kids to come in for the shot, and you were like, well, it's just another shot, just like the flu shot. However, kids are hearing a lot from parents on the news. They hear it on the playground. This may not be quite like the flu shot based on some of the things that they have heard. Any advice you have for parents as far as how to talk to their kids when it's time for this particular shot?
I think it's a chance to really start involving your child in their own health care. Have those conversations with them. It's not something I think to keep secret and spring on them when they get there that now you're getting a shot. This is something that is going to be helpful for them. It's helpful for their family, for their school. I think it's a chance to get them involved in the ideas of healthcare and population health in the appropriate way for their age. So yeah, I think the recommendation is to have those conversations with them about why this is important, why it needs to happen now, and get them involved in that process.
I want to hear your thoughts, Dr. Stites, also, because, most kids have the flu shot out on my kids' playground. But now you've got kids out on the playground saying, well, my mom says it's not good for you. And my dad says you got to have it.
Right.
So how do you,
I don't know, God. This is the same discussion we've been having with all of America for the last, year, really, since this vaccination first started coming out, or 10 months now. And gosh, I remember when the vaccines first started coming out last December, and we were like, okay, guys, we're on the offensive, right? This is going to be, we've been playing defense for the better part of a year. Now we get to go on the offensive and try to really attack the virus. And I think I would still say the same thing. This is our opportunity to change the game. And as much as we all want to try to ignore it, the reality is the virus is still dominating our society, right? You can't get stuff in because the supply chains don't work. Mm-hmm. Hospital beds around the country are still often full. People can't get to work. We got remote work. We have this going on. You still have fear dominating so much of our society, whether it's the folks or the folks with vaccine hesitancy have fear about the vaccine, or those who are wanting to get vaccinated have fear about COVID. The reality is that the fears about the vaccine are really not based on science. When you step back and you look at the data, that's just not real. And it's based on internet rumors and stuff like that, and people who don't like to be told what to do, and so they make stuff up. And at the end of the day, what you have to do is say, let's put a pause button on the making stuff up. Let's put the go button on trying to figure out the real truth. And when we step back and we look at billions of people have received this dose, there is not a medication that we have in the world that we can say over last year 1 billion people got it. And that's just a remarkable statement in the history of mankind. We don't have 1 billion people dying from this vaccine. And so what you have to do is step back and say, okay, look, we've had hundreds of millions of people dying from COVID-19, and yet, or millions of millions dying from COVID-19, we don't have deaths from the vaccination. And so at some level, we just have to stop back and say, listen, we understand that there's fear, but what's going to drive your fear more? It should be the fear of COVID-19 and what it can do to your children. How, as a parent, do you feel if you decide not to vaccinate your child and then you watch them get really sick and to die from this terrible disease? And I got to believe, Dr. Meyer, that at Children's Mercy, all those parents of the kids who got really sick, they weren't saying, I'm so glad we didn't get vaccinated. And with the adults, we say when they're really sick, they're, gosh, I should have listened, I should have been vaccinated. And I got to believe it's the same over at Children's Mercy.
We've definitely had some kids and young adults who've been hospitalized who regretted not having the vaccine before they got hospitalized. And, it's not too late to get it after you've been hospitalized. A lot of people were afraid that after they'd had COVID and they get vaccine, they would have a worse reaction to the vaccine, and that actually hasn't panned out. The data on that has really shown that the redness, the swelling at the injection site, and the other kind of fever and muscle aches are exactly the same whether you had disease first and then got vaccinated or you just got vaccinated. So if you're out there and you think, I'm not at risk because I had disease, we know that's not true. We know that the disease can be transmitted by people who had disease. We know people can get reinfected. So please just get your vaccine.
All right, we have a few more questions, but you have a patient waiting for you.
I got to go say, and I just want to say, remember, hope, faith, science, not fear. Hope, faith, science, not fear.
We'll see you back here tomorrow for open mics.
Open mics.
Okay, have a good day. So Kathy wants to know, and Dr. Lauer, I'm going to ask you this. What part of the body will kids at this age be getting the COVID vaccine? In the arm, like adults have? Kathy says that in the past she's had kids get him in the thigh.
We usually do the thigh injections in infants as they're getting those early vaccines. This one should be for children of this age. Those vaccines should be in their arm.
Rebecca wants to know, Dr. Myers, what is the expected time frame for 6-month to 4-year-olds? I was hoping to have a normal holiday this year.
Oh, I know, and I do feel for you. I don't think it will be before the holidays. I wish it would be, but we want them to finish the studies. We want them to have all of the data, and then submit it to the FDA for review and authorization, and then the CDC. And I know it's really hard to wait, but I just don't think they're quite there yet with the younger age, with that youngest age group.
Dr. Hawkinson, Deb wants to know, the news started coming in about this new variant today, about how it is now in 8 different states. That's what she's hearing. Is there any info on this yet? Is it going to replace the current Delta variant, or is the media jumping the gun?
I'm not sure what variant that is. I don't know if it's a Delta Plus or what that is. Certainly, I think we've seen now 2 Delta Plus. One that came out, it really didn't have too much of an effect. Now this other one. What we have seen is that really nothing has outcompeted or proven to be more fit than the current Delta variant. Of course, we are always ready to identify and see what these new variants look like. But right now, we just haven't seen that. We know that there is one that is a Delta Plus going on in England. It's been identified quite some time ago, but really hasn't taken hold. We have seen increased cases, but I think that is more a function of the human behavior rather than the virus itself. So we will certainly be continuing to look at the data and understand exactly what it is. But remember, a lot of what is driving or can drive some of these variants is that human behavior aspect as well. So we'll certainly keep tabs on all the latest info.
All right, Melanie has a question for Dr. Myers and Dr. Lauer. So as a community pediatrician, she's asking this, the upcoming battle at school board meetings will be what happens to masks now moving forward, December, January, February, March. Curious to hear what the doctor's thoughts are. We will have some kids vaccinated and some who will never be vaccinated due to parent bias. Just trying to remain coordinated on the pediatric front throughout our community. What can you add to that? Dr. Lauer, I'll start with you.
Oh, well, thanks for that. This is going to be one of the, it's going to be challenging, and I think, again, we have to go at this with trying to keep the conversation based around what's actually happening and what's backed up by the science. We know that if you're vaccinated and exposed to, and have some exposure to COVID, your chance of infection is greatly, greatly reduced. And I think that's going to have to be part of the decision around how people in school boards respond to these situations going forward. The reality is that if you're not vaccinated and exposed, your chances of getting sick and being able to spread the virus continue to be quite high compared to the vaccinated group. How each place and each school board is going to manage that will be up to them, but we'd sure like to see the rules around that based on CDC recommendations that are based on the science of spread of virus during a pandemic.
Dr. Myers.
It'll be very, very challenging, yeah.
To say the least, Dr. Myers, because I was thinking the other day, great, my kids could be vaccinated as soon as next week. I mean, any minute now we'll be able to take the masks off. It's like, wrong-o, not going to happen. So what are your predictions? So
I don't know what to predict with the schools. It was very contentious over the summer. We saw some schools, there were protests, there were all kinds of things. We saw some schools decide to have mask mandates. We saw some schools that didn't start off that way and then quickly had to shut the school down for a bit of time, and then kind of thought better and decided to have a mask mandate, at least for the first quarter or into the second quarter as well. It's going to be a good month at least before we get this 5 to 11-year-old population vaccinated, and then we're headed into the holidays with Hanukkah and Christmas. I personally want to keep kids in school every day, all day. I think last year was really difficult. There were a lot of kids who were doing remote or hybrid or back and forth, and it was hard. And if you are an unvaccinated kid and you're unmasked and you're exposed, then you're likely going to be quarantined at home. And I want you in school. And if that means you need to wear a mask to be in school, then you need to wear a mask. We know that kids grow better, they learn better, they socialize better when they're with their friends and they're in school all day long. So I think we need to do whatever it is we need to do to keep kids in school.
Dr. Lauer, you must agree with that, I would imagine.
Yeah, no, this is, again, great points by Dr. Myers. The past year of kids being in and out of school, largely out, has not gone well. And so where parents, there's certainly the concern about the physical health of their children in the pandemic and getting COVID and getting sick, but the mental health and social health questions that have come up and been highlighted by the needs for quarantines and closing schools over the past year also have to be part of this conversation about should I get my child vaccinated or not. The goal over the next few months is to have those kids in school. The chances of doing that and having that play out in a positive way are much higher if your child is vaccinated. So just one more reason on the list to go ahead with getting vaccinated and doing the best for your child's overall mental and physical health.
And these are all great questions, and we're going to be joined by a doctor within the next week or so who gives recommendations to schools and has to fight that battle. I won't make you do it, Dr. Lauer. I wouldn't do that to you, I promise. Okay.
Okay, good. Thanks.
You're welcome. Okay, Kathy has a question. You brought up RSV. Is there an RSV vaccine recommended for seniors?
So there is an RSV vaccine in development, so in clinical trials. And I think that the future of that is really bright and will hopefully be really great for the extremes of age where there's the highest risk, but also that immunocompromised population. So Dr. Stites was talking about the lung transplant population that he works with, but also kids who are going for bone marrow transplants and things like that are also at really high risk for severe RSV disease, in addition to those very young children. So it will be great for several populations once we have a vaccine, and that those are in clinical trials.
And I would say that they've also worked on an RSV vaccine for about 40 years, and nothing has come to fruition. And so I think that's why it's so important, and we have to be thankful for this vaccine, for the coronavirus vaccines, and what luck we have had with the spike protein itself. And so that just goes to show you they've also looked for a HIV vaccine for 30 or 40 years. And so I think it's really important to understand the fact that we are really living in a time where we're lucky right now. We have all this technology we've built upon for the last 30 years. It's not a new technology, and we really should be thankful we have these vaccines in as quick and as safe as manner as we do.
Isaac has heard that some people are saying how vaccination might be putting pressure on the virus to evolve. What would that mean?
So, no. Okay, in short, the way a virus evolves is by infecting a new person, and as it replicates, it mutates. And the reason it mutates while it's replicating is because it doesn't repair its genetic material the way our human cells can repair our genetic material, because it doesn't have the cellular structure to be able to do that. Viruses just don't. So it is natural and known that as we spread infection from one person to the next and it grows and divides, it's going to mutate. Its genetic structure is going to mutate. That happens every year with influenza. It happens with other viruses as well, which is why we continue to get sick with them throughout our lives. It's not the vaccine itself does not put pressure on a virus to make it, quote, resistant. That does happen with bacteria and antibiotics, and that is a completely different phenomenon.
Joanne is getting the last question today. When my nephew was 2 years old, he ended up getting a type 1 diabetic, type 1 diabetes from a virus. Have you seen any of this from COVID?
No, we haven't seen type 1 diabetes develop from COVID. There are certain triggers to type 1 diabetes where your body was developing those antibodies and you were probably headed along that path, and then you have an infection that kind of speeds it along. But we've not seen that from COVID.
And I know that some of my endocrine colleagues, certainly when you have more critical illness, they have seen a lot of blood glucose distortions in the body. I'm not sure the longevity of that problem and how long that stays with you after you recover, but we know when you are acutely ill for adults or critically sick, you can have some blood glucose issues.
Okay, I think we got to all of our community questions today, and we got to get these doctors back to work. So I want to get to our final thoughts, and Dr. Lauer, again, I will start with you.
Well, thank you. This is a great opportunity to make a big impact on the virus. We've got the 5 to 11-year-olds coming up. We've got still a lot of work, as Dr. Meyer pointed out, in the 12 to 17-year-olds. Together, that's about 50 million people in the United States. For us to get to the level where we're going to be able to back off of all the mask mandates, quarantining, social distancing, all that, we have got to get this group heavily vaccinated to have an impact on our population. The time to do that is now. It's safe, it's effective, it's being studied very well, and we'd encourage everybody to come in, ask us questions. We'll be glad to get them answered for you, but go ahead and get that vaccine visit scheduled as soon as we have them available.
Dr. Lauer, thank you so much. Love seeing you. Love having you on. Dr. Myers, this is going to be a really exciting time. It's going to be a really exciting time over the next 2 weeks. I can't wait to have you back on to hear how this rollout went. Just your final thoughts. What do you want parents to know as they start to make this decision whether or not to get those kids vaccinated?
Yeah, so I would echo what Dr. Lauer just said, that the vaccine is safe. We know it to be effective. We know that the kids developed a robust immune response in comparison to adults, even with the lower dose, which is phenomenal. So please ask your pediatrician or your healthcare provider if you do have questions, but don't hesitate. And we're really excited to get rolling with this.
All right. Thanks so much. Dr. Hawkinson, wrap us up today.
I just want to thank our guests. The vaccines will be good. We do know that kids, and we've felt lucky about this ever since the pandemic started, that children do much better with this disease and have less chance of those problems. However, as we just heard Dr. Meyer say during this episode, that children have died. We know that children can die. We know that children can get multi-system inflammatory disorder. We know they can get long COVID symptoms, things like fatigue and shortness of breath and headache. And anytime you get this infection, you roll that dice and take that chance. And I don't think it's fair for a child to have to make that decision when they don't have that understanding and capacity of that. And so the best thing to do to prevent that and help reduce that chance of those complications is to get vaccinated. And these vaccines provide a safe way to mount that immune response prior to infection and really help reduce the risk of death and long COVID and multi-system inflammatory disorder as well.
Fantastic conversation today. Great panel. Thank you all for being with us. Coming up tomorrow.
And I remember walking down the hall with him, and one of the other faculty, was basically yelling down the hall, but she was like, "Don't forget to tell Jennifer that if she wants to have another baby in fellowship, we're totally cool with that." And, he went on to, wholeheartedly affirm that statement. And I think that's just one example in which sometimes women can feel as if they have to make these unfair choices, right? Like you need to either focus on your career or go be a stay-at-home mom.
Honoring a true ally of women, the physician here at the health system being nationally recognized for his tremendous support of his female colleagues. We'll talk with him and the female doctors who nominated him for this national award. That is tomorrow at 8. Have a great Tuesday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.